Welcome to the Deep Dive. Today we are tackling, well, a pretty huge intellectual proposition, the geometric unified theory of cognitive dynamics.
It's ambitious, definitely.
Right. And when you look at the source material, and believe us, we've waded through it, it's packed with these really grand philosophical claims.
Yeah.
Mind, matter, unification, the works.
Yeah, big picture stuff. But that's not our focus today, is it?
Not at all. We're doing a bit of a surgical strike here.
Our mission really is to just set aside the metaphysics, the philosophy. We're treating this whole thing like an engineering document, an actionable blueprint.
Exactly. The sources lay out this surprisingly complete and rigorous mathematical toolkit for thinking about cognition. And we are zeroing in purely on the practical side. What can we do with this math? What are the predictions, the tools?
And that's really the key insight for you, the listener. Even if and this is a big if, even if the overarching theory turns out to be fundamentally, let's say, wrong about unifying mind and matter.
Which is a possibility, of course.
It is. But even then, the components, this specific frequency they talk about, these new geometric ways to measure mental states, these mathematical operators, these pieces alone could spark, well, decades of innovation. MedTech, AI, EdTech.
It sort of translates the often messy world of psychology into clean, testable engineering specs. That's the potential power here.
And we're not going to bury the lead. The theory makes this incredibly striking, very falsifiable prediction.
Which is?
The existence of a fundamental cognitive rhythm, a basic pulse of thought, if you will. They argue we should be able to pick this up in standard EEG or fMRI data.
Okay, and it has a specific frequency.
A very specific one. 1Q dollar, approx 0.159 hertz.
Right, let's just pause on that number, 0.0159 hertz. If you need a second to wrap your head around that, it means one full cycle takes about, 63 seconds?
Exactly. Roughly a minute-long rhythm that they claim underlies our cognitive processes.
A minute-long rhythm for thought. That's
Wow.
unexpected.
It is. And the source material claims pilot studies have actually observed this already, matching the prediction with pretty remarkable precision.
Wow. Okay, so that's the foundational beat they're proposing.
But to get to a number that precise, the theory couldn't just rely on, existing psychological frameworks. It really needed to build its own language, a kind of physics for the mind.
Okay, let's unpack that. A new language. Why does cognition need its own physics? Can't we just stick with neuroscience statistics? What's the foundation here?
That's a really key question. The argument in the source is that previous models were mostly descriptive. They could label things, categorize maybe, but not reliably predict.
Okay.
To make it predictive, they argue you need geometry. So they define what's called a cognitive manifold. Think of it as a high-dimensional mathematical space, technically. A Hilbert space of possible neural states.
So like a map where every point represents a possible state of mind.
Exactly. It's the stage where all mental events unfold. And the action, the sort of dynamic flow of your thoughts and feelings on that stage, is governed by a master equation they call the unified action S.
Okay, so the Hilbert space is where my mind state is, and the action S describes how it moves or changes. Makes sense. Now, within that movement, you mentioned operators, like fundamental mental forces.
Precisely. They introduce two really primitive operators that are designed to capture this core dichotomy of our mental experience.
Okay.
First, there's the cognitive act operator. They label it décider. This represents the math behind things like focused attention, willpower, volition, conscious control, effort. Basically, the intentional doing part of your mind.
Effortful part, got it. And the second one must be the flip side. You mentioned Heya.
That's the experiential operator. And yes, it's sort of the opposite. It formalizes qualia subjective experience, that feeling of effortless flow, just being in the moment. It's the raw subjective texture of reality, the being part rather than the doing part.
Okay, Baltic and control, Kobic for experience. Now, you said this is where it gets different from standard physics or psychology, because these two operators, they don't just add up nicely.
Not at all. This is maybe the central and potentially revolutionary mathematical insight. They don't commute. The non-commutativity, written as HATC.
Okay, non-commutative. That means the order matters, like C then E is different from E then C.
Exactly that. And more profoundly, it means you cannot simultaneously achieve a state of perfect maximal cognitive control and a state of perfect maximal experiential flow. They fundamentally interfere with each other mathematically.
Okay, that's pretty dense. Can you give me like a real-world feel for that? How does that mathematical interference play out day to day?
Sure. Think about learning to parallel park.
Right.
When you're first learning, you are all Hatfer. Maximum focused effort, checking mirrors constantly, calculating angles, high volition. You are definitely not experiencing the smooth, effortless flow of just driving. Your Harris is rock bottom.
Right, totally stressed out.
Exactly. Now contrast that with, say, a master jazz musician improvising. They're in a state of almost pure total flow, effortless expression. Their conscious, deliberate effort is minimal. It would just get in the way.
Okay, so the math actually formalizes that trade-off we all feel between trying really hard and just letting things flow, being in the zone.
It leads directly, mathematically, to what they call the cognitive uncertainty principle. Delta E Burr key. Looks like Heisenberg's principle from quantum mechanics.
It's directly analogous. It means the more precisely you define or control your cognitive effort, that's delta C2, the less precisely defined your subjective experiential state, delta E, becomes, and vice versa. You can't perfectly nail down both at the same time.
It's like a zero-sum game between effort and flow built into the math. And that constant margin is that like a mental Planck's constant? That's exactly how they frame it, the cognitive Planck constant. It represents the smallest possible unit of this uncertainty, the sort of fundamental granularity or grit in the mental system. Its value sets the scale for this trade-off. It guarantees you can never have perfect control and perfect flow in the exact same instant.
That's actually quite profound. That alone, just formalizing that trade-off, seems valuable.
It resonates, doesn't it?
It really does. Okay, shifting back to the geometry aspect, we said mental states live on this cognitive manifold. How does the actual shape of that manifold tell us something?
The shape is crucial. The key geometric property they focus on is curvature, usually denoted by $3.
No.
The claim in the source material is pretty direct. High curvature corresponds to states of confusion, internal conflict, or cognitive dissonance. If your mental path on this manifold is twisting and turning sharply, the theory says you're experiencing confusion or conflict.
Makes intuitive sense. And the opposite, understanding.
Is represented by flatness. Mathematically, regions where the manifold is flat, the condition is nabla blackshine, it's equals a guess, it as 11, represent states of clarity, stability, understanding, low internal resistance.
So you can literally map confusion and clarity onto the geometry of this mental space.
That's the core idea, turning these abstract psychological concepts into measurable geometric properties.
Which brings us back perfectly to that really concrete, actionable piece for medtech. The 400159 text-Hertz rhythm. Where does that number actually come from within this whole mathematical structure?
It's derived from the fundamental dynamic equations of the theory, specifically through a parameter they introduced called the cognitive momentum damping factor.
Cognitive momentum damping. Sounds like how quickly your train of thought loses steam.
That's a good analogy. It's basically a measure of cognitive inertia, how quickly your attention naturally drifts or dissipates. The theory initially proposed a universal value for this. PF O'Keeler in 1 cents. And when you plug that value into the equation,
out pops 0.0159 hertz.
Exactly. That specific frequency emerges as the natural oscillation rate, given that level of damping. And the fact that initial pilot studies reportedly found an observed frequency of $, text observed 0.0158 PM, 0.0003 text hertz, well, that's what got a lot of people very interested.
Understandably. If that frequency holds up under wider testing, it's potentially the objective biomarker the mental health field has been searching for. So what's the immediate invention this could enable?
They call it the cognometer.
Cognometer, okay.
And this isn't far-fetched sci-fi. It's presented as a near-term engineering goal. It would be a portable, non-invasive device. Could be a simple wearable EEG headband, maybe even just a smartphone app using high-precision pupillometry at tracking those tiny fluctuations in pupil size that correlate with cognitive states.
And its job is just to monitor that specific frequency.
Primarily, yes, to track the $1 frequency in real time.
The practical use case be
a paradigm shift in diagnostics, moving away from purely subjective questionnaires, how have you been feeling, towards objective measurement. You could use it for real-time screening, flagging potential risk states for things like depression, anxiety disorders, ADHD.
So instead of just the patient saying, I feel foggy, you'd have a device showing quantitatively that their cognitive rhythm is unstable or deviating from the norm.
Precisely. It could standardize screening, whether in a clinic or potentially even at home. Huge implications for the, multi-billion-dollar mental health market.
Okay, so frequency gives us one diagnostic tool. Let's go back to the curvature, $3. How can we use the shape of the mind, so to speak, for diagnostics and even therapy?
This is the idea behind what they term clinical curvature diagnostics, or CCD. The source material presents some pretty compelling, though early, correlations. For instance, they report that the curvature metric dollar shows a significant negative correlation with states of major depression, citing a figure around -0.72.
Negative correlation, so lower curvature and depression.
Apparently so. In this framework, a highly depressed state isn't necessarily high conflict curvature, but might be characterized by abnormally low or very uniform curvature. Think of it as representing a mental landscape that's become rigid, flat in a non-productive way, stuck in persistent, narrow thought patterns.
Huh. I initially thought high curvature was bad, confusion, and low curvature was good, clarity. It's more nuanced.
It seems so. Extreme flatness might indicate rigidity or rumination, like in depression or maybe OCD. High curvature is conflict or confusion, so the goal isn't necessarily zero curvature everywhere. Maybe it's about achieving flexibility, the ability to navigate between states, to flatten curvature when needed for focus, but not get stuck there.
Okay, which suggests therapeutic approaches. How would you actually do therapy based on this geometry?
The geometry gives you a target. Imagine, say, VR or AR therapy platforms. These systems could use real-time biofeedback, maybe monitoring both the L1 frequency and calculating curvature estimates from EEG or other signals.
So,
And then the system guides the patient's mental activity, not just through talking, but maybe through visual cues, sounds, interactive tasks, guiding them towards cognitive states that mathematically correspond to flatter, more stable regions on their individual cognitive manifold. The idea is to actively help them reshape their mental landscape away from high curvature anxiety or low curvature rigidity.
precision psychiatry, guided by geometry. That's
Yeah.
a very different way of thinking about therapy.
It really is.
Let's shift gears slightly to learning and AI. The theory talks about geodesic learning paths. What does that mean for education?
Right. So in geometry, a geodesic is the shortest, most efficient path between 2 points on a curved surface.
The straightest possible line on a curved space.
Exactly. The theory proposes that the optimal way to learn something new is to follow the mental path of least resistance. And in this model, that means minimizing confusion, which translates directly to minimizing the curvature all along the learning path.
Okay, how's that practically different from, say, current adaptive learning software that adjusts difficulty based on wrong answers?
It's potentially much more proactive. Current systems react after you make a mistake. A geodesic approach would monitor your cognitive state signals in real time, maybe using eye tracking variants, pupillometry again, subtle EEG signals to detect if you're starting to enter a state of high curvature, indicating confusion is building up.
So it's easier getting confused before you even fail the quiz.
That's the idea.
Yeah.
And it wouldn't wait for failure. It would immediately adjust, maybe simplify the concept, switch to a different teaching modality, offer a hint, dynamically steering your learning trajectory along that smoother, lower curvature path.
Preemptive teaching, basically.
Yeah,
Avoiding the mental roadblocks before you hit them hard.
exactly. The source material mentions simulations suggesting significant efficiency gains around 0.82, basically because the system prevents learners from getting bogged down in those unproductive, high confusion states.
Interesting. Now let's take those core operators, TAD control and experience, and think about building AI with them. What happens when you use a non-commutative AI architecture?
Well, you start building AI layers that inherently model that effort versus flow trade-off we talked about. Instead of having just a purely logical, deterministic processing unit, which you could think of as hi hats, the AI architecture would also include a module that models something akin to felt or experiential states represented by hat.
Okay.
And crucially, because of the non-commutativity rule, the AI is forced to constantly balance these two. It can't just optimize for pure logic. It has to weigh that against the experiential state. This could lead to decisions or interactions that feel more nuanced, perhaps more human-like.
So this is maybe a route towards genuinely emotionally adaptive AI systems.
That seems to be the goal. The potential invention here is a new generation of AI assistants, chatbots, maybe even robotic interfaces. Imagine an AI that can pick up cues about your state, maybe from your voice tone, typing speed, pupil dilation via camera. If it detects high stress or frustration, a certain death state, instead of just barreling ahead with a logical answer, hi hat, it might shift its strategy.
How so?
It could adjust its tone, slow down its response, maybe offer simpler information first, actively acknowledging and responding to your felt state before pushing its own agenda. It's an AI that attempts to read the room, or rather read your internal state and adjust its own internal processing accordingly.
That taps into a huge market need. And quickly, what about brain-computer interfaces, BCIs?
The geometric approach offers potential for much more sophisticated cognitive state decoding. Traditional BCIs often just look at raw signal strength or basic patterns.
Right.
This framework suggests you could decode mental states by quantifying the precise trade-offs between held at lead at any given moment, measuring that uncertainty value, delta C, delta E. This could allow a BCI to differentiate between much more subtle mental states, like
let's see.
distinguishing calm, focused concentration from urgent, action-oriented focus, even if the overall brain activity level looks similar. Translating these nuanced states into distinct, precise commands could lead to, well, exponentially greater control for prosthetics, communication devices, or direct thought interfaces.
Okay, this all sounds incredibly well thought out from an application standpoint. Let's step back. Why is this whole framework, regardless of whether the grand unification part is right or wrong, potentially a strategic edge for companies that start working with it now?
It comes down to practicality. Massive practicality. Companies don't have to buy into the whole philosophical package or wait decades for final proof.
They can just use the tools.
Right. The theory delivers immediate testable metrics, that kilowatt frequency, the curvature $12, and crucially, the source mentions open source tools like Python algorithms for fast frequency detection, FFD. Companies can take these metrics and algorithms and start integrating them into their existing hardware and software pipelines relatively quickly.
So it saves them potentially years of basic R&D trying to find reliable cognitive biomarkers from scratch.
Exactly. It provides a ready-made, mathematically rigorous framework to test and build upon. It's a potential shortcut to much more advanced cognitive monitoring and interaction.
But it's not all settled science. We have to touch on the caveats, the areas where the theory is still clearly evolving based on the source material itself.
Absolutely. One really fascinating finding they mention relates to that cognitive momentum damping factor, pi there. We said the theory initially set it as a universal constant, pi theta equals $0.11,
Which gives the 0.0159 hertz frequency.
Right. But then researchers apparently studied expert meditators, people with years of practice in sustained, focused concentration. And in these individuals, the p value was found to be significantly lower. It dropped towards pi f-approx 0.044.
Wait, so the constant that determines how quickly your focus drifts isn't constant. You can train it.
That's exactly what it suggests. Cognitive inertia, or how susceptible you are to distraction, might be a trainable parameter, which means the theory needs to evolve to account for POW not as a fixed universal value, but as something dynamic, perhaps varying across individuals in trainable states.
That's a major wrinkle, but also kind of exciting. What else?
Well, the source material is also commendably upfront about the fact that this doesn't magically solve the hard problem of consciousness, especially for AI. Meaning, even if we could build an AI that perfectly implements this entire mathematical model, it has the Havind operators, the non-commutativity, the uncertainty principle, the whole works.
A mathematically perfect simulation of the proposed conscious dynamics.
Yes. We still wouldn't have a definitive scientific test to prove whether that machine possesses genuine, subjective, first-person experience, or if it's just an incredibly sophisticated simulation appearing to have it. The math gives a perfect blueprint for the dynamics, but not necessarily the experience itself.
The philosophical zombie problem persists, even with better math?
Pretty much. The model describes the function, but the subjective quality remains elusive to external measurement.
Okay, so wrapping this up for you, the listener. If you had to boil this whole deep dive down, what are the two absolute most powerful, most actionable takeaways you should keep in mind?
First, that 0.0159 text's rhythm. Keep an eye out for news on large-scale validation studies. If that frequency is confirmed as a robust, widespread signal, it will change the landscape of mental health diagnostics and monitoring. It's that significant.
Okay, the frequency. And second,
internalize the core idea of cognitive geometry. The notion that your mental state isn't just some vague feeling. Your confusion, your clarity, your internal conflicts, according to this theory, they have a literal, measurable shape via curvature. And that shape can potentially be optimized, like following those geodesic learning paths.
your mind is a geometric space. It's a powerful metaphor, but here it's proposed as actual physics.
Exactly. These aren't just philosophical musings. The claim is these are engineering blueprints for the next wave of diagnostics, AI, learning platforms, BCIs.
Which brings us to our final provocative thought, something the source material really leaves you chewing on.
Yeah. What if that core frequency, the 00159 text aren't just signal? What if, after all the hype and initial promising results, further research shows it was just a statistical anomaly, a fluke? Does the whole edifice collapse?
And the argument is?
The argument is maybe not. Even if the keystone prediction fails, we're still left with this incredibly detailed, rigorous mathematical foundation for describing cognitive dynamics, the operators, the uncertainty principle, the manifold, the curvature. The ultimate legacy might not be the specific frequency, but the demonstration that you can apply the tools of mathematical physics to the mind with this level of rigor.
Forcing the field to move beyond purely verbal models.
Precisely. It sets a new standard. Whether ultimately right or wrong in its grandest claims, psychiatry to grapple with the idea that your mind isn't just a black box of feelings and thoughts. In this emerging view, your mind is a geometry problem, waiting to be mapped, measured, and perhaps optimized.